this is Marika, and welcome back to another session on interpersonal relationship. So in our last session, we have seen what is interpersonal relationship, what is the purpose of interpersonal relationship, right? Today we are going to see what are the different phases of interpersonal relationship. There are four main phases of an interpersonal relationship. The phases of interpersonal relationship, it must progress stage by stage, okay? Because each step builds on the one before. Now, as I said, there are four different phases in interpersonal relationship. The first phase is called the pre-introductory phase. The second phase is called introductory phase. The third phase is called working phase, and the last phase is called as termination phase. So we are going to see one by one what are these different phases and how a nurse and client will react to these phases. The first one is pre-introductory phase. So from the term itself, we can understand what pre-introduction means, before the introduction, right? So what is a pre-introductory phase? So this is a phase before the actual interview. This is the planning phase before the actual interview. In pre-introductory phase, in most of the situation when we are talking about nurse and client, the nurse will have the details of the patient or the basic information of the patient in the pre-introductory phase. So in this phase, the nurse and the client have not met one another, but this is the phase where the planning is made for the interview or for the encounter. Now, as I said, this is before the face-to-face interaction between the nurse and the client, right? So the nurse will have information. The information will only contain basic information. For example, it includes the name, the age, the address, gender, and the medical history of the patient. Okay? In this phase, the nurse develops feeling of anxiousness. Okay, so this stage, the pre-introductory stage, is the stage before there is a face-to-face interaction between the nurse and the client, right? The nurse has the basic information for like the name of the patient, the age of the patient, what is the patient suffering from, and what is the gender of the patient. Okay, so here in this phase, before the nurse is meeting the patient, actually the nurse might develop some anxious feelings. The second phase is the introductory phase. So from the term itself, we can understand what an introductory phase is, right? It is a phase where you are introduced with something, right? It is also known as orientation phase, okay? And it is this introductory phase is considered to be the most important phase because this phase sets the tone for rest of the relationship between the nurse and the client, okay? Now, what happens during the introductory phase? During the initial encounter, when they are meeting for the first time, the nurse and the client, they observe each other closely and they form certain judgment about each other's behavior. Okay? For example, even when we are meeting with someone for the first time, it is obvious that we observe each other, right? We try to understand each other and we have certain kinds of assumptions and judgments about each other, right? Similarly, like that, here also in the introductory phase, when the nurse and the clients meets for the first time, they observe each other's behavior, they observe each other, they also form certain kind of judgment about each other. Now, this phase, it includes getting to know each other. Okay, in this phase, the nurse and the client gets to know one another and also they develop a certain degree of trust. Okay, now once they have encountered or once they have had a face-to-face interaction and introduced one another, what does the nurse do, right? The nurse can engage herself in some social interactions to put the client at ease. During the initial part, the client or the patient sometimes may show certain resistive behavior. Okay, obviously when you're meeting someone for the first time, you may have a anxious feeling, right? You may be nervous about meeting that person. So initially, if you're not able to open up, in general also, we know that we develop some kind of resistive behavior. We don't speak up, right, when you meet for the first time. Similarly, like that, here, the patient may also develop certain resistive behavior. Now, what happens if the patient is resistive? Such kind of behavior, it inhibits involvement and cooperation between the nurse and the patient. Now, how can this behavior of a client, if the client is showing any kind of resistive behavior, how can it be overcome? These can be overcome when a nurse conveys an accepting attitude towards the client, or when a nurse shows genuine interest towards the client's well-being. If the nurse conveys a caring attitude and genuine interest in the well-being of the client, it will also help to foster trust in the relationship, because this is the initial stage of the nurse-client relationship. The client has not developed trust fully over the nurse, right? If the nurse is conveying a caring attitude or genuine interest towards the client's well-being, this will help the client to develop some degree of trust in the nurse. By the end of introductory phase, the client should begin to, first one is development of trust. Okay, the client should start developing certain degree of trust in the nurse. Okay, the second thing is the client should view the nurse as a competent nurse who is able to provide help to the client. The client should view the nurse as open, honest, and concerned about their welfare. The client should also develop a belief that the nurse will respect the confidentiality, and the client should start feeling comfortable with the nurses about the sensitive feelings and other issues. The third one is the working phase. Now, what is the working phase? During the working phase, the nurse and the client start viewing each other as unique individuals. In this phase, the nurse and the client begin to appreciate and care about one another. Now, this working phase has two major stages. Okay, first one is exploring and second one is understanding. Now, you have to understand that it is the working phase or the middle phase where all the nursing interventions are carried out. Problems and issues are identified by the nurse with the help of the client, okay, and plans to address this concerns or the problems identified are put into action. The nurse must help the client to explore his thoughts, his feelings, and actions. Now, this is a problem defining phase, right? Here, the nurse and the clients talk to one another and identify the problems or define the problems that the client is facing. Okay? Now, once the problem is defined, you have to understand what type of service is to be provided to the client. Okay, here the client seeks for acceptance. He conveys his needs to the nurse, asks questions about his health and related problems, shares his expectation. Now, what does a nurse do? The nurse responds to the question asked. She explains about the roles to the client, identifies the problems, and use the available resources and services for the welfare of the client. Now, as I said, all the nursing interventions are carried out during this phase of the interpersonal relationship, right? So here, once the problems are being solved, as the problems are getting solved, you may also see that new problems may arise, okay? New needs of the patient may also emerge as the older ones are getting solved. The nurse must be vigilant enough, the nurse must be competent enough to look for the new problems that are arising and also find a solution to the new problems which was not identified earlier. Now, the nurse will help the client during the working phase to plan a program of action to meet goals. Okay, so as I said, working phase is the most important phase because most of the nursing interventions are carried out here. The problem that the client is facing is defined. Once the problem is defined, the nurse explains and responds to the client, right? She helps the client understand what are the roles and duties done there, right? She also helps the client to plan a program of action to meet his goals. The nurse requires certain skills to carry out the working phase. Okay? The first one is empathetic listening. As I've said earlier when we were dealing with communication, we said that the main key to communication, to good communication, is active listening, right? So here the nurse must be empathetic listener, which means the nurse must put herself in the client's position while she is communicating or getting any information or message from the client. The second one is respect and the third one is genuineness. Okay, the nurse must be genuinely interested in client's welfare. Okay, the last phase is the termination phase. Now, what is the termination phase? The termination phase is the last phase in the nurse-client relationship. Now, this phase is considered to be the most difficult phase in the nurse-client relationship or in a therapeutic relationship. If the previous phase, which means the pre-introductory phase, the introductory phase, and the working phase, if these phases have evolved properly, or if these phases have taken place properly, the client will have a positive outlook and feels that he or she will be able to handle problems independently. Which means if the phases has taken place properly, right? If the working phase has been carried out properly, if the interventions are done properly, what happens? The client will feel that he or she will be able to take care of themselves. Now, in this termination phase, the nurse and the client can sit together and they can review the entire therapeutic process, or they can summarize the therapeutic process, which means they can sit and talk about the problems that were identified earlier, how things were at the beginning and how it is now. So now let us see the last phase of interpersonal relationship, right? We've seen the first three phases, the pre-introductory phase, the introductory phase, the working phase. Now let us move on to the very last step and the most important phase of interpersonal relationship, that is termination phase, okay? So as I said, termination phase is the last phase in nurse-patient relationship, okay? It is the last phase and it is considered to be the most difficult phase in IPR. Now, as I said, there are three phases before the termination phase, right? So if the previous phases, the pre-introductory phase, the introductory phase, and the working phase, if these three phases, the previous phases, have evolved properly, the client will have a positive outlook towards his problems, and also feels that the patient himself will be able to handle his problems independently. Okay, so this only happens if the previous phases have evolved properly. Okay, now what does cut? Now, in the termination phase, techniques such as reviewing the process or summarizing the process of patient care can produce a sense of accomplishment among the nurses as well as for the patient, right? So when you look to the past, right, when you look in the past and see that how patient was, what was the health condition of the patient, and how the process of interpersonal relationship and how the procedures that were planned and implemented have helped the patient to overcome, right? So in the termination phase, the nurse and the client can sit together and review the process that they have undergone, okay? So when they summarize and review the process that they have undergone, they may have a sense of accomplishment. So this may include the nurse and the client sharing with one another or talking about how things were in the beginning and how things are now. So what are the improvements that has been seen in the patient's health? Okay. The discussion of termination discussion must be started in advance before the actual process of termination happens. Okay, so the nurse will know that the termination is okay, cut. So the nurse will know that the phase of termination is approaching near, right? Now, once the nurse knows about the termination of the patient, the nurse must start the discussion about termination with the client. Why? Because doing so allows the client, by doing so, the nurse is giving time to the client to adjust to his independence, which means all this while the patient was hospitalized, right? The patient was inside the hospital or under nurse's care, right? It was a nurse who was doing or carrying out activities for the client. It was the nurse who was helping or assisting the client to carry out any kind of activities, right? Now the patient will be terminated, which means the patient will have to carry out those activities on his own, right? So we have to give time to the client to adjust to his independence. So in order to provide that time to the client so that he adjusts to the independence, we start the discussion of termination beforehand. So this brings us to the end of the phases of interpersonal relationship, right? To conclude, we have seen what are the different phases in an interpersonal relationship, right? The first phase is the pre-introductory phase. What happens in pre-introductory phase? The nurse and the client have not met one another, right? Here they are planning to meet another. They know that they are going to meet one another, right? There are just plannings for the meeting of the client, right? During this phase, the nurses develop anxious feeling, and the nurse will have very basic information about the client, like the name of the client, the age of the client, the address, and maybe the diagnosis of the patient, right? The second phase is the introductory phase, right? In the introductory phase, as the term itself suggests, the nurse and the client are introduced to one another. They meet face to face, right? So during this phase, the nurse and the client form some kind of judgment about each other, right? And in order to make sure that the client is at ease, the nurse can get involved, or the nurse may engage in some kind of social interaction. Okay, so during the introductory phase, it is obvious because the nurse and the client does not have that kind of relationship, or they do not have a developed trust in between. The patient may also display some kind of resistive behavior in the introductory phase. But by the end of introductory phase, the nurse and the client must develop certain degree of trust between one another. All the procedures that are carried out by the nurse in order to help the client overcome his problem is carried out during the working phase. And the last phase is the termination phase. As we've discussed, termination phase is the last but most important phase, and it is also one of the most difficult phase, right? So in order to make sure that the client adjusts to his independence, the nurse must start the conversation of termination beforehand. So these are the different phases in interpersonal relationship. I hope the class was helpful. I'll see you all in the next session where we will discuss the remaining aspect of interpersonal relationship. Thank you. Have a good day.